from the Heart of Medicine, and I think this is probably the application I have been waiting so long for. So it's been years and years since I'm like, why isn't there any application to learn EKG, like trial and error, which is so important instead of just reading a textbook? And I think I might have found this one, and I actually stumbled upon it because in my cardiology fellowship program, actually one of the authors uh, made this application and I had no idea, and he just shared it with us, and that's incredible. So yes, he didn't even tell me or tell anyone to try to sponsor the application, but I'm really liking it, so I'm trying it out. Here you have different things you can play around with it, but I'm just going to show you the quiz section, which is the one I'm working on right now. Let's see where it is. It was, I think it was here. No, EKG set A. I was doing some question sets. So let's see, review or QBank. So as you can see, I already did QBank 1 through 5. Let's just do QBank number 6, and you're gonna see how it is. Okay, so test your knowledge. Which of the following can be a normal variant? Okay, benign early repolarization, yes. S1, S2, S3 pattern, not sure. Oh yeah, I think so. Notch P wave with normal duration, yes. So I know this one and this one is correct and this one is also correct. I don't even have to read this one. But let's see, QRS less than 0.10 seconds is normal. RSR or small r, large S, small r in V1. Not sure about this RSR, but I can say that these three are correct. So I'd say all of the above. Submit. And there are several types of normal variants, such as the ones we spoke about. And if you click on these hyperlinks, it actually takes you to where this was taken from. So you can even go through the literature, which is pretty cool. Here you can see it. This can be as easy as 1, 2, 3. Okay, that's perfect. Let's get back to our application. Let's finish this short quiz just so you can see there's a lot of artifact. So 47-year-old female brought by ambulance to the hospital near drowning, shivering from being cold. Select the correct answer. So there's a P wave, so it's not atrial flutter, it's not AFib, it's artifact, and that's it. So here it explains basically what's going on. Typical tremor artifact, which is of course normal due to the cold and shivering. And now let's see this one. So here you can see a deeply inverted T wave. It's symmetric, usually talks about ischemia. So that's what I would go look for here. So it's telling me myocardial ischemia. That's what I'm going with. Yeah, here you have it. Causes for it, for deeply inverted T wave, usually myocardial ischemia. You can also see it in bundle branch block, hypertrophic cardiomyopathy, PE, raised intracranial pressure, etc. Go on to the next question. Here I'm seeing a biphasic T wave. So initial part is negative, then it's positive. Let's see what they're asking us. Biphasic T wave, there it is. I'm going with that. And it not only shows you what's going on with the image, as you can see, it shows you what's going on. It underlines it, which is great. So it catches your attention. And most of us out here learn through reading, through also seeing. And this is a great visual aid. So these two are great. And let's see. T waves can be with terminal positivity or terminal negativity. Okay. If T waves, biphasic T waves with terminal negativity are present in V2 and V3, consider presence of Wellens pattern type. Remember, Wellens is the one that is telling you that there's potential obstruction of proximal left anterior descending. It was usually first described in the anterior wall, which would be V2, 3, 4. But you can also see Wellens in lateral wall. It's just the analogous concept, right? Which would be telling you about maybe the circumflex. So let's go on to the next question here. 30-year-old female came to the ED with palpitations, 35 weeks pregnant, no problems. EKG shows sinus tach. What would you expect to find on the EKG? Okay, so heart rate, of course, if they said sinus tachycardia, heart rate is going to be above 100. So we rule out this one and rule out this out. No, yeah, this one we rule out. And since it's sinus tach, it's going to be P wave that is before the QRS. So we rule out this one. What inverted P waves is telling you that it's not sinus. So it's going to be this one, right? So there are some questions that are going to be a little bit easier than others. but of course it's very useful here, and it here explains a little bit about what happens during pregnancy, that there's more blood volume, increased cardiac output, so there can be a little bit of sinus tach. Let's see. In addition, regardless of the physiological, other cases should be ruled out, of course. So yeah, all the other causes for sinus tachycardia. Let's go on to the next question. So if you see this EKG, what's interesting? This is interesting right here. Rest of it looks normal. So it's like an additional deflection. It could be a retrograde P wave, right? Because I don't see any P wave here. So this could be a junctional rhythm, for example. So retrograde P wave is in the options, and that's the answer. And here it says it's junctional rhythm, can be seen in healthy young adults. Okay, here it shows you where it is going, and perfect. This other one here, you see that this beat is very similar to this beat, and this is very different to these two, but similar to this one. You can see that the QRS is above 0.12 seconds, and inverted T wave. So this is like a bundle branch block pattern. So this is a PVC, premature ventricular contraction. So no, oh, bigeminy, yeah, it's after each of them. So this would be bigeminy, one normal, one abnormal. That's bigeminy. So there you have it, and they're circling what's going on, and they're explaining what's the issue. Okay, perfect. So we're about to finish this quiz. 41-year-old male arrived to the ED with alcohol intoxication. EKG shows AFib. What do you expect to find on the EKG? Okay, so it's basically asking you, how does the AFib look on EKG? How could you describe it in words? So absent P waves are the most important thing. Flutter waves, that would be atrial flutter, so that's out of the picture. There is absent P waves, so whatever it says there is a P wave is out of the picture. So you can rule this one out, or you can rule this one out, you can rule this one out, and this is the right answer, because remember that atrial fibrillation is irregular rhythm without any P waves. And there you have the answer, okay? And you can go through it. You can see the other causes for atrial fibrillation, and here it shows you an example. And 43-year-old male, let's look at the EKG. I like to just look at the EKG, so you think, what is your electrocardiographic diagnosis? You just think about the electricity without the history, and then it's very important, of course, to take into account the history, because no EKG is worth anything without a history, right? You can have ST elevation, horrible looking. If you have no history, you don't know if it's a ventricular aneurysm that has been going on for 5 years, or if it's an acute ST elevation. So, MI, okay? So, here what are we seeing? This is like a additional deflection, right? This, you can see this up slurring, it's a little bit altered, it's not straight up. This looks like a delta wave. When you see delta wave, you think about Walt-Parkinson-White, which is one of those pre-excitation syndromes. So here you have delta wave. Well, it was a 43-year-old male coming to the clinic with palpitations. Okay, so yeah, here you're just seeing the delta wave or Walt-Parkinson-White pattern. When it gives you symptoms, it's called Walt-Parkinson-White syndrome, which probably this patient is going into the supraventricular tachycardia. Here you have the arrows pointing at the delta wave, and that's great. And let's go on to the next one. Here you can see PVCs, another PVC right over here, and this is going to be couplet PVCs. Okay, it gives you the explanation, and that's it. We passed the quiz. That's great. And let's go on to, yeah, that was it. Now I have all these other quizzes which I will go through. That is perfect. But there's other things you can also do on this application. So I haven't gone through the whole thing, but I like to see this simulator, so you can actually check here. You can just hover over and you can see, oh, this is the U wave. You can test yourself. This is something I love. I remember when I was studying anatomy in medical school that there was this CD or application that had the Netter's anatomy, and it has no words on it, and you had to basically answer yourself what was each anatomical structure, and you could quiz yourself, and then you could reveal the actual text in the book, and there was no way to beat anatomy learning than that. Because if you just see the answer here, oh, you just see a P wave, you see P wave, R wave, there's nothing like for you to test yourself. But this way you can test yourself, and of course if you're a beginner, you're gonna enjoy doing this. If you already are advanced, you probably won't do much with this, but you can always see these different specifics, and you can always take it one step further. As you can see, I'm a cardiology fellow and I am definitely enjoying this, and I'm sure I'm going to learn a lot. And for example, you can teach your brain how to look at this, because 60 beats per minute, let's see how it will look. Preview will be this. You can change it to, I'll be there in 1 second. You can change it to 100 beats per minute. And that's about it for this video. See you in the next one.